Hey, I'm Allyson, CORE Physical Therapy. I'm a physical therapist, and I wanted to do this Facebook Live today to try and help you guys have some tools on how you might fix yourself. I've used a lot of these concepts that I'm about to teach you when I'm out on a run, on the trail, and I happen to tweak something, or you feel a muscle or some spot on you hurts. It might be an old injury, it might be something new, but you can use this idea to try to fix whatever. And I'm going to teach you, there's 6 movements you would normally try, but I'm going to do one today. Maybe we can follow up with some more, but the one I'm going to do is going to address the core. So there's 2 for the arms, 2 for your core, and 2 movements for your legs. Today you're going to learn one that's focused on core. A lot of things and problems in your shoulders, arms, and legs will stem from your core, so it's a good place to start. It's called an upper twist. And you can do any of these movements, but this one specifically you can do in any position you like, and you might find which position works best for you. So what you're looking for with these positions is asymmetry. I'll demonstrate. I'm standing up right now to do it. I'm going to not use my hands. We're not pushing or torquing or trying to go for more range of motion, but we're just relaxing our hands and seeing how far can I go over my left shoulder. And then we look, and how far can I go over my right shoulder? I don't know if you guys can tell, but I don't go as far over my right shoulder as my left. So you notice that. You can try it in sitting. And this is kind of nice because it keeps your hips stable. So if you have a hard time stabilizing, this might be a good place. Or if something hurts in your hips, you might start in sitting. And try to the right, and try to the left, and that might be different in sitting than it is in standing. You can do this on your hands and knees. So if I were to do that, it would look like a twist this way, or a twist to that direction, and see which way feels better, which way is easier, which way you have more range or less pain. Any of those things would make for my left is way better than my right, or vice versa. It would make for an asymmetrical condition. So then what you do, since I was standing in the beginning, I'll do that one for starters, is you can, so my right one was more limited than my left one. So I'm going to go to the way that was easier or less painful or had more range to it. Any of those kind of conditions. The better way, the good side, the easier way. I'm going to go to that way, and I'm going to hold it for 20 seconds. And with every second that I can, I'm going to try and twist a little more, get a little more range of motion in that direction. I might practice some of my breathing from Pilates that you already know. Try and get taller, twist a little bit more, and that's my 20 seconds. I'm going to do 2 of those. So I'll do another one. Twist to the easy way, the better way, lengthen, big breath. Twist a little more. A little more. Okay. And then with all of these, you test in the beginning. You do your 2 20-second holds, and you're going to test at the end. So we'll go to the left. This is my easy side. We're going to go to the right. And that's better. It still feels a little tighter, especially in my hip, than the other way does, but it improved. And that's typically what I see. When you do 2 20-second holds, the bad side will get better when you treat the good side, which is usually a side you're willing to move and do something with anyway. The other thing you could do if it's a movement that doesn't lend itself to stretching and holding is I could have done 20 repetitions and 1, go back, 2, keep trying to go a little further each time, and I could have done that 20 times. I could have done 10 times if that's enough and your body's not going to take any more. Retest and see how that bad side was. A mistake a lot of people make is they'll test the good side, they'll go to the bad side and like, wow, that's so much better, and they'll keep doing this. You don't need to keep doing it, just retest it. It's good. Keep going on your run or keep going through your day. You don't need to do another 20 times on that bad side. Just be happy that it's better and move on. A lot of times you can do this in a yoga class or a Pilates class that you're taking, you notice the asymmetry because you're doing movements on both sides. Go to the good side a couple of extra times in your class and see if that doesn't help the bad side. Or do that later on your own. You might just remember what was the asymmetrical movement. So I taught you all the upper twist. You can apply it to any movement you want to, and see if treating the good side doesn't help alleviate your problems on the bad side. Anyway, I'd love any comments that you guys have about the live video, and of course, hi to those guys that are watching it. And I'm here at CORE. I'm a physical therapist here, like I said, and if you need more help or you want more explanation, or if there's anything we can do that would make your life better, please give us a call at 512-215-4227, and we'd love to talk to you about more of this kind of stuff, more of the stuff that's going to make you feel better and be able to do the active stuff that you want to do. We have 20-minute free sort of consultation discovery sessions that you can do if you want to just kind of explore what that looks like for you too. So just so you know, you've got options, but try that and see if it helps. See ya.